We're joined by Kerala's Health Minister Veena George. Ma'am, the second Pinarayi Vijayan government is completing 2 years, and right now I just read a message from your office that you had before coming here. You had a meeting with the WHO officials who had praised Kerala's free clinic method. So we already have a robust system in place when it comes to health sector. How do you look to in the coming days or in the coming years? How do you look to bring in more measures when it comes to health sector?
As you said, we have a very good system which has evolved through years. And this government has started a mission in health sector and it's called Ardram. And under this session, we primarily aim at turning all the hospitals or the health centers to patient-friendly ones or the people-friendly ones. So for that, we are changing the infrastructure, developing new infrastructure. So when you look at the IP strength or the OP, we can see that it has increased hugely over the years. Now it's like if 100 people are going to to hospitals, 70 are to government hospitals. So that means 70% they come to the government hospital. So it's really a challenge to us. We have to rise up to their expectations. So the first thing that we do is that we are continuously building up new infrastructure. Second, new treatment facilities. Like this year, we'll be starting robotic surgery at Regional Cancer Center and Malabar Cancer Center. And also the third one, and it is on giving free treatment or to reduce the out-of-pocket expenditure of our people. So these three things are our main focus. And again, we have so many things which we have added on this, as per the Navakerala Karma Pathati, Ardram mission, we have set 10 aims like eradication of diseases and tackling lifestyle diseases. So for that, we have started annual health checkup. So we have 1 crore 71 population that is above the age of 30. So this year we have screened up to 1 crore 36 lakhs and we are continuing that. So it's for identifying those who are having lifestyle diseases, and we are cross-checking whether they are taking treatment, and also we are analyzing the risk factors and also diseases like heart diseases and cancer, etc. And also we are aiming at eradicating some diseases like malaria, TB by 2025, 2026, etc. We have set some goals, so we are working on that. And also we are trying to change the lifestyle. So this lifestyle is something which is very important, which indeed defines or which is the cause of diseases. So we have started a lifestyle campaign.
Ma'am, when we talk about all of this also, there is a protest going on by the nurses. Like when we talk about the quality, and the quality of our nurses is famous all across the world. How is government looking to address this issue of the nurses?
In the private sector, so it's actually dealt with by the labor department, and the government has a view that they should be given decent, reasonable remuneration, salaries. So they have the right. So government is discussing the issue with the private management, and also we are hearing from the nurses organization, so they should get it. It's like we have last government has already made a settlement agreement like thing, so actually they have to follow that. Some private managements have already started giving good salaries during these days, and so government has a view that they should get.
Like one incident that shook the entire country was the conscience of the entire country, especially in Kerala, was the murder of Dr. Vandana Das. I mean, we saw how much it affected you also personally. But like we brought in the amendment to the ordinance to bring amendments to the Hospital Protection Act. How do you think that this is going to work with stricter punishment and all of that in hospitals? Like when we look into a real scenario.
See, the Hospital Protection Act was passed by the Kerala Legislative Assembly back in 2012. Yes, a maximum of 3 years punishment and maximum of 50,000 penalty. And also, only few categories were included in that, like doctors, nurses, students, etc. So we amended this act, like we included all the health workers, everyone who is working inside a hospital, inside a campus. So he or she will be included. Second thing is that we ensured a minimum punishment, like from 6 months to 5 years and 7 years, and also minimum penalty, like from 50,000 to 3 lakhs or like that. So this is like strengthening or gapping the loopholes, or so strengthening that original act, and it's done. It's actually I had discussed. We had a round of talks with the doctors' organizations, nurses' organizations, and paramedical staff organizations. So back in April, and they gave me some suggestions. They gave me the representations, and based on that, we were working on that. But now we have passed. The cabinet has decided to issue the ordinance, and it's already signed by honorable governor.
Since it's 2 years of completion of Pinarayi Vijayan and 2 years of you as health minister. Now I remember in 2021, one of the most talked about ministry was yours, because you were taking over from KK Shailaja, who had made a massive name across the world. How do you look back at your 2 years as health minister? Because we've had a huge celebration in Kerala about Pinarayi Vijayan government's second years.
See, these 2 years, actually, this new government was on in the midst of second wave, and on May 20th was the swearing-in ceremony. So, till 2022 April, we had the second and the third waves. Every day we had the review meetings. We had many things. Like the first thing I took, the challenge which I took was that vaccinating everyone. So from there we traveled, and after actually we got some like 7 months, or 7 to 10 months to look into the other matters. But we have done many things, like the free treatment. So this has increased many folds, and now over the past 2 years we have given free treatment for an amount of 3,200. And also we could start people's health centers in every local area, and we could pass many laws like the Medical Practitioners Act. Many laws, like 3-4 laws were passed. And also we could start two new medical colleges in Koni and Idiki. We could start 2 nursing colleges in government sector, and 14 colleges in private sector, and also about around 1,300 new seats were added. And also this SAT was recognized by the Union government as a center of excellence. We have started clinics there, and also for the first time in the history of Kerala health public sector, we could start liver transplantation surgery, and it's done totally free, and all the surgeries were successful. We are going to start a new institute at Kozhikode, and also for the first time in the country we could start neuro cath lab and dedicated ICU for doing thrombectomy and at Trivandrum Medical College. So many new things were done. So yeah, so we are doing that.
Just last question. You have many times sat on this seat because you were a journalist. For the uninitiated, she was a journalist. In fact, she was the first, from what I remember, she was the first female to become the executive editor of a Malayalam news channel. Do you miss your journalism days, ma'am, any time?
I don't have time to think about my old days, but it was my passion. Yeah, thank you very much.